Okay guys, so we're going to look at the range of motion assessments for the hip joint. Okay, so this is obviously going to be an important one for many of the lower body exercises that people are going to be doing in the gym. So the hip joint is one of those areas in the body where there definitely is a bit more variation in terms of the range of motion that people have available, and this can certainly be reflected in different exercises that people do, such as squatting, such as deadlifts, and this is also heavily influenced by body proportion, because if you've got someone like who's real tall, they've got big long legs, big long femurs in particular, then generally when they squat, if they're leaning forward a lot, they're going to have a little bit more hip flexion involved in their squat. So as a result, hip flexion could be a real limiting factor for that individual in terms of getting down really low, versus someone who maybe has a longer torso and real short legs, short stumpy little femurs. For that individual, they might squat perfectly upright like an Olympic weightlifter, and for that individual, when they squat, hip flexion isn't really going to be a limiting factor because of their ability to stay upright. They're not using as much hip flexion to get to the same relative position as the person who's more kind of folded over in their squat. So that's where this kind of stuff can start to become relevant, particularly as we think about individuals who maybe have a history of injury or some sort of surgical history, especially as personal trainers now, as more people get involved in exercise, particularly as they age, we're going to be working with a lot more individuals post total hip replacement or even pre-total hip replacement, people with kind of later stage hip osteoarthritis. The hip is one of the main areas that is affected by osteoarthritis. So one of the features of that is typically going to be a reduction in range of motion. So for example, when clients have unilateral hip osteoarthritis on one side and a reduction in range of motion on that side, it might be useful for us as trainers to be aware of the discrepancy between sides and range of motion if we're going to be building exercises for individuals or getting people to do our exercises based on arbitrary range of motion standards. We might want to reconsider in those contexts. Okay, so with all of that said, guys, we want to start by having a look at hip flexion range of motion. So Paddy, if you could lie on your back on the bench. This is just a nice convenient way of starting to look at hip flexion range of motion. Okay, in a kind of a physiotherapy context, for example, you might want to be a bit more specific in terms of actually assessing range of motion and grading strength, for example, because what's going on here as Paddy lifts up his leg is in the bottom position, gravity is basically working against him. It's creating a challenge, whereas up the top, as he moves further and further upwards, basically gravity is kind of starting to assist him. So that's something for a physiotherapy context to consider if you're trying to grade strength and the person's ability to work against gravity, to lift their limb against gravity. But for the purpose of us as personal trainers, we're really just thinking about the person's ability to move through that range of motion actively. Okay, so Paddy's able to move up into, like, if we're going to grade it, you could obviously use a goniometer to measure the angle, but you probably don't need to worry too much about that. If we're going to look at that, we're going to say, okay, he's definitely over 90 degrees. He's maybe pushing 100, 110 degrees of hip flexion there actively, okay? And he can probably get a bit more if I was to push him, and that's when we start to get into passive range of motion as we push an individual further, okay? So you might have a person who's got quite a bit of a discrepancy between active and passive range of motion. For example, if Paddy can only lift to there himself, let's say he's had some sort of hip flexor strain and it's really difficult for him to pull further because of actual weakness or muscle injury, he still might have the passive range available to push him a lot further. And the other thing to understand here, guys, is that we're always thinking about 3 dimensions when we're thinking about hip flexion. So when I initially got Paddy to basically pull his leg up into hip flexion, that's going to be a different amount of range of motion that's available in that plane of motion versus when we bring in some abduction and external rotation. So if I bring Paddy's leg out to the side, so towards you guys in the camera, and now he pulls up, he's probably going to be able to get a little bit further. So there's generally a bit more freedom of movement as you get into that part of the range of motion. And that's one of the reasons that when people do squatting exercises or leg press exercises, that they'll often open up their knees a lot and kind of rotate their knees outwards to kind of open up the hips, and that often frees up a little bit more range of motion. So you might see that if a client pulls their leg up right in front, they don't have that much range of motion available, whereas if they pull it out to the side a little bit and then up, they've got a lot more range of motion available. So that can explain that sort of phenomenon that you see when people have that discrepancy between squatting with knees facing forward. You can rest that down. Squatting with knees facing forward versus squatting with the knees out a little bit and really trying to force the knees out as you get to the bottom. So again, it not only explains why that takes place, but it can also inform the types of cues that you give your clients. So if someone says to you, for example, I've never been able to squat down deep before, and you see that they're squatting in that fashion, kind of knees forward, you might say to them, you know, why don't we actually point the knees out a little bit, and as you get to the bottom, I want you to really focus on pushing the knees out. That might open up a little bit more range of motion for them, and it also kind of helps with the balance element of the squat as well, but that's something for a separate video. Okay, so that was us basically looking at hip flexion range of motion. There's obviously other ranges of motion that we might want to be aware of as well. One of them is hip abduction, and for the purpose of assessing hip abduction, we can basically do this in a number of ways, okay? So we can do this in a standing position. You don't have to do that for now, but in a standing position, basically what I might want to look at is that I'm keeping the body nice and straight and that the person lifts the leg out to the side like that, okay? Generally, you're not going to be assessing that, to be honest, because it's almost always an exercise-specific consideration. If you are assessing it in standing, you're going to be seeing how far the person can bring the leg out to the side. It's really something that's a bit more practical to assess in a kind of a supine position like this. So you can still do an active assessment technically, because if I hold Paddy's leg like this, I'm just holding his ankle. Now bring the leg out to the side for me. So out as far as you can go. I'm just supporting it from the top or from the bottom so that he doesn't have to like lift it up, but I'm just seeing how far he can go out to the side. So can you push out further? So that's just giving me an idea of how far he can bring the leg out to the side. Is that ever going to be relevant in most of the exercises that we choose to use in the gym? Maybe not. It might be relevant, for example, in something like a sumo deadlift. So if I see that Paddy's only able to bring his left leg out, let's say just very slightly out to the side, he's like, oh no, there's a pinching immediately, for example, then that might, you know, be something that's informative if we're going to do a sumo deadlift. Because if I'm telling Paddy, let's do a sumo deadlift, and this is the starting position, and we're way out here and lots of hip abduction, then that might be something that's actually really provocative for him. So I mightn't put that in his program. And a lot of the time, when you do come across those kind of hip abduction limitations, this isn't a hard rule, but it's kind of a sound rule of thumb. You might have some sort of passive restriction, for example, in passive range of motion. So you'll feel that yourself. Like if I take Paddy's leg and I bring it right out to the side, it's not really comfortable to kind of just keep going. It's not a very comfortable position, and he's looking at me because he knows that. It's not a nice position to just force someone into that range of motion. But if you are assessing it, you can have a quick assessment passively. Sometimes you'll have people whose legs just go out absolutely fine, and I know that'll be the case if I rotate Paddy's leg out a little bit. But what you have to remember is that sort of position with toes facing forward, pure hip abduction, that's kind of the starting position for a sumo deadlift, although there is obviously other movements at the hip and the knees as well. So take home point there from a hip abduction perspective, it's not something I'm going to say that everyone needs to go assessing, but in some cases, such as those cases with the sumo deadlift, or maybe you're doing other abduction exercises in the gym, it can start to become relevant. It could be the case that you're actually doing an adduction exercise, like the Copenhagen adductor exercise, for example, and if someone's coming down to the bottom position and they're actually finding that they're getting a lot of pinching in the outside of the hip and that's real uncomfortable, then that could be just them pushing beyond their range of motion that they have available. And that can be the case in some cases where people have some sorts of hip injuries, for example. Sometimes with some hip injuries, it can be the case that person gets like a strong pinching sensation or pain within the hip joint as they move into abduction, and that range of motion can be reduced. So if you're trying to design exercises and have people do exercises such as sumo deadlifts that are quite demanding of that range of motion, then you might want to be aware of that in advance, see if there's a restriction, and see if that restriction is consistent from side to side. And again, it's not about always assessing or screening in advance. Sometimes it is just a case of seeing, okay, this person is reporting this problem. I might have a quick look at their range of motion that they have available, and then you can see, okay, right, the left side is actually significantly reduced, and when I pull it out to the side passively, they're in a lot of pain. So as I begin to perform exercise with this individual, I'm actually going to keep that in mind, and I'm not going to try and push them too far, you know. So that's abduction, that's hip flexion. The next things you might want to consider are actually rotation at the hip. So rotation at the hip is an interesting one because it's kind of counterintuitive in some cases, because basically the way we're going to look at it is in this position up here, you're basically going to take yourself to 90 degrees of hip flexion, and internal rotation is basically moving the foot out, so moving the foot externally. So it is a little bit counterintuitive, but basically internal rotation of the hip is going to be where the knee is in that position, and I'm going to move the foot towards you, so moving the foot out away. That's a really provocative position. Very few people are going to like it. Anyone who's any physios that are here in the group, you'll be aware that once you take people into internal rotation, it's rarely a nice position. Okay, so you're not generally going to be trying to do many exercises that involve a lot of internal rotation, but it does come up in some contexts. For example, both Paddy and I do Brazilian Jiu-Jitsu, and that's a position that you often get into, is that internal rotation position, and you certainly do want to have a bit of range of motion available in some positions, but yeah, that's essentially internal rotation, foot out to the side. So if I want to look at that in an active context there and see what Paddy can do, there are a number of ways you can kind of look at that. One kind of simple way, if you just want to look at it quickly in this position, is just for me to hold that in position for Paddy and say, right, move that leg out for me to the side. So I'm just making sure that he's keeping the upper thigh straight, I'm supporting it for him a little bit, and then I'm just seeing how far he can pull out to the side. And he's got plenty of internal rotation range of motion available. External rotation, exact same thing, just the opposite. So if I do that passively, I'm basically just bringing the foot in. That's external rotation because the hip is rotating externally, the foot is moving internally, and that's giving me an idea of the range of motion that's available there. Again, similar idea when we're looking at the active assessment here. All right, I'm going to keep that stable. It's obviously easier to stand on the outside here. Keep that stable for him in some way, and then I'm going to get you to bring the leg in. Okay, and you can do that without even holding the person's leg. Like, they're still generally going to be able to hold that just fine. But that, again, it's just giving you an idea of what range of motion is actually available there. And where might that be relevant? Again, it might be relevant in some contexts, such as, again, Brazilian Jiu-Jitsu, if you wanted to see what sort of range of motion someone has available actively, or you want to see what they have available passively. I can push them a bit further. You can obviously see what this stuff looks like in different stretches. For example, if someone's doing a stretch, and that's obviously technically an assessment of passive range of motion as well. The hip external rotation is also built into a lot of exercises already, such as a sumo deadlift, for example. A sumo deadlift is effectively a combination. It's not only hip abduction, but as the person moves to the bottom, they're also rotating their knees out, and that's challenging their ability to externally rotate at the hips as well. So again, that's somewhere where it might become relevant. And of course, there's other examples where it can come up too, but that is your hip external rotation. So there, the rotations, that's hip abduction. You're rarely going to be assessing range of motion in terms of hip adduction. It's just not particularly relevant, because one of the things that's interesting about hip adduction is that we're basically limited by our other legs. So yeah, you can bring the leg across the body, but again, it's not something that's really practical from a personal training perspective. And a similar thing with hip extension. So hip extension is effectively just bringing the leg behind the body, but it doesn't really go back very far. We're typically looking at 5 to 10 degrees of hip extension. And in general, when we train hip extension, it's generally from a flex position to a neutrally extended position. So it doesn't tend to be something that is particularly limited a lot of the time. Typically, it's kind of hip flexion, hip abduction, and rotation that will kind of present as being restrictions for people sometimes. Generally, the others don't tend to be too much of a problem. With that said, you can assess, for example, tightness or tension in the hip flexors and reductions in hip extension range of motion because of tightness at the hip flexors, for example. But that's kind of a unique assessment that we will do in a separate video, so just kind of keep that in mind for the moment. Not one for this video, but it is something we will get back to. But for the most part, guys, that's what we wanted to touch on in relation to the hip joint. Remember, it's all about bringing this back into practice. So I don't expect you guys to go and do all these assessments on your clients and build exercises from the ground up as if, you know, you never knew what an exercise was. That mindset can be useful sometimes, but in general, if you're getting your client to come in and they're doing a leg press and it's absolutely fine and all is happy, they're getting great results, you don't need to go back and say, oh, but we need to see how much range of motion you have available actively and passively first. That's not how this works. Rather, it's a case of, right, your client came in, they did a leg press, they said that they've got, you know, hip osteoarthritis on one side, and they said that their hip is real tight when they do that exercise. That's when you start to say, oh, would you mind if we have a look at your range of motion? And then you see, okay, there's a 30-degree discrepancy between sides. Maybe we could do unilateral variations, or maybe when we do bilateral variations, we could meet the standard of the weaker leg or the more restricted leg rather than trying to meet the standard of the stronger leg or the more mobile legs. So hopefully that gives you some practical advice. As always, if you need more context here, you have more questions, you need more detail on anything mentioned, let us know. We're more than happy to help out in terms of providing more specificity or further videos that can help your understanding. But hopefully that allows you to put some of this into practice with your clients and hopefully help them get better results.